Today on the American Health Front, we'll explore cutting-edge technology that helps adults and children breathe easier so they can get the sleep they need. Come with us as we discover how the use of advanced diagnostic hearing tests allow you to hear the world more clearly. And if you want a healthy and beautiful smile, find out how lasers could be the answer you're looking for. Hello everyone, I'm Ernie Bjorkman. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Bay Area edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could really change your life. So stay with us, because there's nothing more important than your health.
First on the American Health Front, we'll focus on a problem that affects millions every night, and the advanced technology that can help.
Millions of men, women, and children aren't getting the sleep they need. Many sleep problems are related to sleep disorder breathing, and the most common conditions are snoring and/or sleep apnea. Otolaryngologist Dr. Thomas Engel of San Francisco ENT Medical Group tells us about cutting-edge coblation technology that helps patients breathe easier and sleep a lot better.
Sleep-disordered breathing is one of the more common problems for which I see patients. Symptoms typically are snoring, labored breathing, or actual apnea, where you stop breathing for at least 10 seconds. Usually parents will notice these symptoms and bring their children in for evaluation, or in the case of an adult, a sleep partner. In addition, kids will sometimes have extra symptoms such as irritability from poor sleep, hyperactivity, or attention issues in school. Most often, these problems in kids are related to enlargement of the tonsils and adenoids.
First, Dr. Engel performs a complete assessment to evaluate the problem.
Sleep disorders in children can often be determined by the history and physical exam. Parents' description of the sleep patterns is crucial to coming to a diagnosis. Oftentimes I'll have patients or parents videotape their sleep, which can demonstrate patterns of abnormal breathing, or perhaps uncover patterns that people are used to that are really abnormal. In situations where the diagnosis is not obvious in children, we'll occasionally do formal sleep studies which involve monitoring of oxygen levels and breathing patterns, either with portable equipment in the home or in a formal sleep center.
Now let's explore why coblation technology is emerging as the superior choice for treatment.
Enlargement of the tonsils and adenoids is the most common cause of sleep-disordered breathing in children. Surgical removal of the tonsils and adenoids relieves obstruction and restores quiet, restful sleep in the vast majority. This procedure, which is called tonsillectomy and adenoidectomy, has been done for many years. In the past, it was done primarily for chronic infections, but now about 75% of tonsillectomy and adenoidectomy surgery in children is done for sleep-disordered breathing. There have been many techniques for doing the procedure, and all are effective, but all have resulted in severe sore throat, difficulty eating, and sometimes difficulty maintaining adequate fluid intake. In recent years, the procedure has been most commonly performed using electrocautery, which uses high-temperature electrical energy to remove the tissue. This results in a severe sore throat and usually a difficult recovery. In recent years, coblation technology has been applied to tonsil and adenoid surgery. This uses radiofrequency energy, which is a much lower temperature than traditional electrocautery. Surgery still requires general anesthesia, but usually takes about 15 to 20 minutes and can be done on an outpatient basis. The big difference with coblation is in the recovery period. More often kids eat soft foods sooner and require less pain medication than traditional electrocautery surgery. The usual recovery requires pain medication in the first few days and then less so over the next week. Children more often eat soft foods and drink better than with traditional electrocautery surgery. I used to get frequent calls from parents about children being unwilling to eat or drink after tonsillectomy, and now that's almost unheard of. The usual recovery requires some liquid pain medication in the first few days and then minimal over the next week. Children usually eat soft foods shortly after surgery and are generally back in school within 1 week.
Dr. Thomas Engel offers coblation tonsillectomy and adenoidectomy procedures, along with other modern techniques and technology to help you breathe easier.
If you'd like more information about anything featured on today's program, or if you miss any of the important numbers that will be shown throughout our program, please call 1-800-984-2010. Our staff will be happy to direct you to the medical professional that could be of particular interest